When life gets unpredictable, preparation matters. In medicine, it's all about staying alert, ready for whatever comes through the door. On the road, it's no different. That's why Volvo designs vehicles to help anticipate risk, reduce harm, and protect lives. The Volvo XC90's advanced safety systems inspire confident decisions wherever the road takes you. The Volvo XC90, for life. Proud sponsor of the Pit Podcast. Learn more at volvocars.ca/safety.
Welcome back to the show. Justine McIntyre here. We're talking now about the nearly 1 million unnecessary visits to emergency rooms, which highlight Canada's primary care crisis. There's a new report from the Montreal Economic Institute that reveals that nearly 1 million emergency room visits last year could have been avoided if Canadians had better access to primary care. Some experts are urging a reevaluation of our healthcare model and suggesting we look to Germany and the Netherlands for solutions. Here to speak with us is Krystle Wittevrongel, Director of Research at the Montreal Economic Institute. Welcome to the show, Krystle.
Thank you so much for having me.
Did I say your name correctly?
You did, actually, 100% right off the bat.
Thank you. It's a tricky one. Okay. So I want to get into this. There's only 26% of patients that were able to secure a same-day appointment, and that's one of the reasons people are turning to emergency services for care. What's the problem here? Why aren't more people able to secure a same-day appointment?
Yeah, so you're absolutely right. We see that 26% of Canadians are able to get a same-day or next-day appointment. Okay. And that's compared to about 50% in Germany and the Netherlands. And this is partially because people just don't have access to primary care providers or a regular access to get care. And so what we found is that about 1 in 7 Canadians cannot access primary care at all. And this is compared to virtually all Germans and Dutch citizens. And so, as you can expect, and as you did mention, this drives people to ending up in the ER when they are in need of care. Often it is not needing to be in the ER, but they just don't have access to that health care that they do need to prevent them from going to the emergency room.
Probably the worst place that you want to be unless you're actually in need of urgent care. Now, we've had some announcements from the healthcare minister here in Quebec who's talked about, for example, obliging medical students to work for 5 years in the public system. Would that help to relieve this situation?
I mean, it's one alternative, it's one option to this issue, but this is something that has been considered or done in other provinces for a great number of years already, and these provinces are also still having these issues. So it's not going to be the one and only fix or the solution to this problem, just like increasing spending, on primary care is not going to fix our problems either, because this is seen across the country. When we look at Germany and the Netherlands, who spend about the same as we do on healthcare as a proportion of GDP, and then about the same as we do on primary care, we see vast differences in the way that people are able to access that care. And the most recent Commonwealth Fund ranking for access specifically had Netherlands at number 1 and Germany at number 3, Canada at number 7. So we definitely have some access issues that, go beyond some of these solutions that we've currently tried or have historically tried in the past.
So, Krystle, what is the Netherlands doing differently? Since they're sitting in the number 1 position, what can we learn from them? What are they doing that's working well?
Well, one of the things that both Germany and the Netherlands have is the ability for patients to go to a specialist directly without requiring them to see a family doctor. In Germany, generally speaking, you opt for this as part of your insurance package, and in the Netherlands, there's some mechanisms in place that allow for it. And this really just takes off that additional step of care where, 26% of Canadians are waiting 6 or more days to see a primary care provider and then waiting to go see their specialist and so on and so forth. So it's removing that first step, that unnecessary step for many, which also then takes off some of that burden on the provider who is managing multiple visits in between or the administrative tasks of the referral and so on and so forth. So it's just giving patients a more direct line of care rather than kind of the patriarchal oversight of a gatekeeper system like we have here in Canada.
That makes sense to me. And what about some other things that I noticed, differences that I noticed? I lived in the United States for a few years. I was in Seattle, and major differences, obviously, between the medical system there and here. And one of them was that most of the time, I wasn't seeing a physician, I was seeing a nurse practitioner. Is that something that is also recommended in terms of freeing up resources?
Absolutely. I do want to note that the numbers here of people with access to primary care actually includes nurse practitioners, as well, as they're used as a proxy or can provide quite a bit of the same primary care services as a family doctor. That is one way that provinces, Alberta specifically, is opening up the potential for nurse practitioners to have their own clinics to try to take some of that burden off of family doctors and let them see the patients that they need to see. But these numbers are also including those professionals. So while it is definitely a good thing, it's not really moving the dial on some of these figures.
Okay. And is there anything else? So you mentioned being able to see a specialist directly, so not having to go through the sort of gatekeeping system that we have here in Canada. I feel that our system here is very, it needs to be modernized. We have a certain way of doing things. We force people to go through the system in a certain way, and it really does bog it down. Are there other things that we can do, that we can learn from the way medicine is practiced in Germany and in the Netherlands?
Well, the systems, the healthcare systems in these countries are composed of quite a number of different insurance providers, whereas in Canada we have one insurance provider for our medically necessary care, which is through the public system. And so having these alternative insurance providers, which are required to offer a baseline primary care. So it's not that, some insurers don't offer it or whatever. It really allows for the benefits of competition and multiple attempts to be made to make things better. So if we see one thing isn't working, as an insurer, you are incentivized to try to make things work for those customers that you have. Whereas with one system here in Canada, there's very little incentive to try new things or to innovate in any way, because it's status quo just sort of wins at all times. And these other countries don't have that. So in Germany, there's 175 insurance plans. Some of them offer gatekeeping, some of them don't. People are able to pick and choose what works for them. Patients have more choice, and that results in greater access to care at the end of the day.
This is a conversation that I'm not sure we're ready to have in Canada, Krystle. I think that people are so protective of our public system that as soon as we start talking about introducing an element of competition, it's like the political rhetoric just kind of freezes up, and we don't want to have that conversation. But can you talk to us more then about, because you're saying that in Germany they have over 100 different providers, but everybody is taken, there's a baseline of service that's provided as a public service, yes? So is this an approach that could work in Canada, and how do we get people to talk about it?
Yeah, so they are required by law to offer a basic package, and then it can be scaled up from there depending on the preferences of those customers that opt for those insurance packages.
Okay.
And so it just allows an element of customer and patient choice that it's so unknown to us to even comprehend what that could look like, because we don't have choice in any of our healthcare here in this country. I think the conversation piece that you mentioned is really interesting, because we are so emotionally attached to a system, but the system isn't working, yet we're not ready to talk about it's not working and what that could mean. It's this conundrum that I just don't quite understand either. But it's whether it's public insurance or private insurance or public practice or private practice, what matters is that it's accessible for patients. And we don't see that right now. And I think that is what we really need to be talking about is we can't access this system. It's public access, but it's not universal access. When we're trying to keep things universal, and these other countries these are universal systems as well, who have universal access. We don't seem to have that access here in this country.
Krystle Wittevrongel, thank you so much for sharing your research with us today.
Thank you for having me.
Krystle Wittevrongel is Director of Research at the Montreal Economic Institute, and we've been speaking about different approaches to healthcare than the one that we have here in Canada.